Welcome back to the Tracy Donegan podcast. Cancer treatments often come with painful side effects, including debilitating mouth ulcers, also known as oral mucositis. But did you know that light therapy can actually reduce and in some cases help prevent these complications? Today, I'm talking to someone who uses this every day in real patients. Stephanie Amy, a registered dental hygienist who has been in the dental field since 1999 and has specialized in soft tissue laser therapy since 2007. She's not only sees a dramatic improvement in oral health and comfort in her own practice, but also trains dentists and hygienists to integrate lasers and photobiomodulation, particularly for patients undergoing cancer treatments who are at risk of severe mouth sores. Welcome, Amy. Hi, everybody. You're very welcome to the Tracy Donegan podcast. And today I'd like to introduce you to Stephanie Amy. And Stephanie is here to tell us all about her work with oral mucositis. Welcome, Stephanie.
Hello. Thank you, Tracy.
We've been trying to get this on the calendar for a while and life has been tricky. So tell me a little bit about what oral mucositis is, and how you're working with it in your dental practice.
Yeah. So oral mucositis in simple terms is basically like the breakdown of the mucosal tissue. And this is a side effect of a lot of cancer treatments. So the way I like to describe this to people is think if you've ever had a canker sore. And you know how painful one little canker sore could be, on the side of your cheek. Imagine having multiple of them, and oftentimes larger than your average canker sore. And these can be in your mouth, on your tongue, the back of your mouth, and kind of down your throat. And essentially, this could continue throughout the GI tract as well. So it is extremely painful. It can cause a lot of complications to the patient's treatment because one, if they're not able to eat, they're going to miss out on some nutrition. It can also cause their treatment to be paused or delayed. So a lot of things come from this side effect. And what I have loved is that through what I do with lasers and dentistry is I learned that we can actually use this laser to help treat it if they already have it, but also to use it beforehand and prevent it from happening. And it is such a simple, non-invasive, pain-free way to treat it that, I want more people to know that it's an option because many people don't even know that this is available to them.
This is one of the reasons why I was so keen to have you on for a chat, because as I was looking at on Facebook there yesterday, I think it was the way it notifies you of memories from, and the first memory that came up was from a year ago. So a year ago, this time last year, I had put out a post, like really delighted that, the US had now approved photobiomodulation for oral mucositis, that in 2026 insurance would cover it, and I thought, oh, this is fantastic. This really puts photobiomodulation on the map. And as you said, it's such a simple, and the treatment is so short and it's pain-free. And because I always think of the poor kids that are dealing with it. Like, how do you explain this to a 4-year-old? Because some of the videos that I've seen with kids using the Tor laser, and they're just like, they have this lollipop thing that they put in their mouth for like a couple of minutes, or this like laser head that goes against their cheeks and they do it themselves. But here we are a year on, and nobody still seems to know anything about it. And too many people are still really suffering because the information isn't getting out there. Why do you think that is?
Oh, I think that anytime there's something new, there's always a little resistance or hesitance because it takes time to invest learning about this. And, these nurses, they're doctors, they're very busy. Maybe they don't have the time to learn. And I think that until they're able to embrace it. And not only, I mean, I have tried to educate them and they've seen the results. So that is the part that I think still baffles me, that I think when I have gone into hospitals, I have treated patients, they seem fascinated. They seem impressed. And, they say, oh my gosh, I can't believe that this patient healed from this. And they ask questions. They want to know more. And then I say, please take my information, share it with other patients. Do you have other patients that are suffering from oral mucositis? And they say, yeah, we do. But then it stops. So that part, I wish that I understood why there was the resistance, but I honestly think people are just afraid of things that are new.
Yeah.
So.
Yeah. And I think as well, but people think, I think there's this idea out there that it's laser, and you automatically think, well, laser is, a cutting laser or burning
Sounds
laser.
Scary.
It does, and especially if you're already in significant pain. But I think it's just, I think here we are a year out, and you've been doing, like, this is just me looking at this for a year, but you've been doing this for a couple of years, and you're still struggling for to get the word out. So hopefully this podcast will help generate some more awareness around what is
right.
it's almost, I think it's almost immoral. It is so simple, so quick, and to improve the quality of life. I mean, thankfully, I have never had cancer, but knowing people who have gone through cancer treatment, it's hard enough dealing with just the diagnosis.
Oh, yeah.
But when the actual treatment causes more problems, and people just aren't getting the information, I just find it really hard to swallow.
Yeah. And I think that's where it might have to start with the patients and families learning about it, because if the hospitals aren't offering it, at least families that learn about it, they can, access these resources on their own. When I first learned about this, it was a laser course that I took on PBM. And this dentist, who's kind of become a mentor for me, I reach out to him often and have learned a lot from him. I remember him telling a story about a man that he treated with oral mucositis. And this guy was so miserable that he was ready to give up. And he's like, I don't want to treat my cancer anymore. I want to be done, because the oral mucositis was so painful that he was like, I can't do this anymore. And, the dentist that I have learned from, he somehow connected with this patient and started treating him and changed everything around for him. I mean, the man was beyond thankful. Literally, this treatment saved his life, because he was at the point where he was ready to give up and stop. So I think that people don't realize how uncomfortable and miserable this can be for patients. And then to provide that relief, to say it's life changing or could save lives, like, I don't think people understand that it really does have the ability to do that.
When I remember one of the trainings that I took on PBM in the university in France, they had lots of the top experts in PBM give presentations, and there was a presentation that they gave on oral mucositis and PBM. But what was so fascinating was they were twin brothers. And one of the twins had, I'm not sure, it was some kind of head and neck cancer. So, but he had developed, so during the treatment, he developed the terrible sores, couldn't eat, really, and I was on like high levels of pain medication. He was absolutely miserable. So he went through, he was in remission, doing well. But I think it was something like 10 years later, his twin brother developed the same cancer.
Oh, wow.
And became part of a trial. I think it might have been an Australian trial. And he had the benefit of using PBM and had, I think, like, he had barely any symptoms at all. with exactly the same treatment, but using the PBM. Like, and he talks about it, and like his twin brother, like he says, I'm, I'm so annoyed that, he got to have access to this because it wasn't around when I was going through my cancer treatment. But I thought it was such a fascinating story that these twins both developed the same type of cancer in the same area and both had such different experiences just because PBM was.
Because that one simple thing made a huge difference.
Yeah. Yeah, that's absolutely amazing. So tell me about your experiences working with your clients, and if you want to share any, I guess, before and afters, or what are you seeing in your practice that I guess can really demonstrate to people how effective and simple this therapy is?
Yeah, I can definitely share some photos here. Let's go to this presentation. Okay. Are you able to see the presentation up?
Yeah, go ahead.
Okay. So here is a 15-year-old that I treated. And you can see here the back of his throat, the lesions. And again, when I was contacted, this kid was miserable. He had to be admitted to the hospital. He was not able to eat. So he was, with feeding tubes, and came in and we started kind of easy, and I did carotid and then popliteal. So that's behind the knee. And this is an area that's very vascular and helps just kind of get the blood vessels and get things circulating there. And started off with that treatment, then came a couple days later. And we upped it a little bit more. So this time I went intraorally and treated each of those lesions. And then I did extraorally. I still did carotid. We did some submandibular, cervical area, and then the popliteal fossa again behind the knee. And then the third treatment, I forgot to take my photos, but we did the same treatment sites as the second day. And then this is after 3 treatments. So this is when I came back on the 4th day. So after 3 treatments, you can see, those lesions are already much, much better. There's still some redness around there, sure, but he was able to get relief. He was able to start eating some, softer foods, drinking stuff like smoothies, and his mood was getting better. And then you can see, so I thought this one was pretty cool because this is on one day. He ended up developing a canker sore or a lesion on his tongue, and pretty big there. But one day later, so after one treatment, it is already almost gone. And if anybody out there knows, a canker sore does not go away in one day. Those things last easily 7 to 10 days, sometimes even up to 14 days. So I think this slide really just highlights how quickly we're able to get some healing.
Amazing.
Yeah. And then, so this is coming back for the 5th treatment. So this would be results after 4 treatments. And again, it's pretty much, it's on its way to being fully healed, but there's still some of the redness that we see. But what matters is that he was able to start eating. He was getting up. I remember coming one day, he was tossing a football around with his brother. And prior to that, he just looked miserable. He, wasn't smiling. His mom his mom was crushed because she's like, I don't know what to do for him. And I was like, it's okay. We're going to get this under control. And it changed everybody's attitude, because to see him joking, smiling, throwing a football around, I really don't think people understand or realize how impactful these lesions can be on everything, overall health. Again, risk for infection. So here's just a timeline. After he had those lesions, I started seeing him through the rest of his chemo treatment. And you can see here the day before chemo, I started treating him. And then 2 days after he received chemo, and we kind of went on this pattern, sometimes every 3 days, depending on what the schedule allowed for. And so I'm just kind of showing again, highlighting timelines. But the important thing is once we started with this kind of preventive treatment, he never got another lesion throughout the rest of his treatment. He never had to delay treatment anymore. He never had to stay in the hospital. So all because of this very simple, pain-free, light that we're shining. So that highlights oral mucositis. If you want to see some other examples of healing here,
yes, yeah,
these are things that I've done just again with my scope of dental hygiene, head and neck areas. We have an injury. Let's see, what was this one from? Oh, this was a football and with braces. So you can see it cut. This is 4 hours after the injury and just 24 hours later. I mean, you can see it's already starting to heal. The redness is gone.
And this is like I think just to highlight for anyone watching, that's 45 seconds was the treatment. So we're talking about less than
Right.
10 minutes.
Correct.
Yeah.
Yes, it is very quick and very effective. And then I think I have, yes. So here's another one. This was a softball to the face. And this is immediately after. So about 30 minutes after the injury. And this is 1 hour after. So you can see how swollen the area is. Did one treatment 12 hours later. So this is not even 24 hours later, but you could see initially right here. And then 12 hours later, look, it's already starting to heal. And this is 24 hours later. And then this is by 3 days. So again, something like that is not going to heal after 3 days, just doing our conventional methods. So that just highlights some of the stuff that I've been able to do and continue wanting to do more and help as many people as possible.
It's so interesting because a lot of the work that I do is with mucosal tissues for women's intimate health, but a different part of the body,
Right.
but responds really well to the light as well. And we don't need, I think, again, for anyone watching who's interested in PBM, because of the mucosal tissues, we don't have that epithelial layer. We don't need lasers. We can use LED because we don't have that extra layer, and we don't have, we're not trying to get through fascia and muscle.
Right,
So it's
exactly.
in direct contact with those mucosal tissues. I remember talking to Dr. Ream in the UK, who's again one of the world leading PBM experts and researchers. And it was a presentation that she had given on, I think it was oral mucositis as well. And it was about a year ago. And I remember thinking, okay, so these tissues are very similar. So there it shouldn't be too difficult to adapt some of these protocols for women's health, which I've had really enjoying this work with women and helping them with inflammation and all kinds of pain issues. So where do you see this going next? I mean, do you foresee that we're going to have hospitals, that this will just be a standard part of care, or I think there may be devices already in development so that, people can do this themselves at home and don't have to go to a special place to do this, especially because it's so safe.
Right. I would love to see that happen. I know there are a lot of other people out there that feel the same way, and, other dentists that I speak with, and there's other people like me that are out there trying to get into hospitals and talk with nurses and doctors and oncologists. And it has been a very slow moving discussion. And I have these, I just very optimistic person thinking, no, like someone, it's gonna get through to someone.
Yeah.
It's not happening yet. But I am hopeful that the more, I think that there is a lot of talk about PBM, and I think that you can't escape it for much longer. You're going to have to take the time to learn about it and hopefully invest in, educating yourself and then incorporating it, because it really, as we just saw, it does not take that much time, that much effort. And as you said, patients can even hold the light on it themselves, if it's not an actual like class 4 laser.
Yeah.
If it's a device like I have this one right here. Anyone can use a device like this, and I know that you have other options that you recommend. So yeah, I don't see why it should be that difficult, but it has been difficult to get it.
Yeah, I'm the same way. I'm like, it's coming whether they like it or not. We cannot ignore the research anymore, but it is that research practice gap.
Yeah.
And I think as well, I have seen kind of rumblings out in the research world around device manufacturers coming up with something that's specific for this. Because I think what a lot of people are doing now is they're kind of looking for devices that will kind of fulfill the dosage and a little bit of experimentation.
To take all the guesswork out of it and just have something ready to go.
Point and shoot, literally.
Yeah.
Because I think right now, people are just trying to figure out, what am I, like, everyone has these big panels and like, how can I use this? And like, how can we need to make this affordable and accessible and get everyone educated, dentists. And because even in where I am in Texas, I've talked to a couple of dentists about just using laser for pain management in their practice. And they looked at me like I have 10 heads. So I'm like, it's coming, because the dentists I think dentistry, especially here in the US, there's so much research on PBM. I think dentistry has kind of pushed PBM out into the mainstream.
Yeah.
All of the research that they've done, but it's just, I think some people think, oh, it's dentistry. And I'm like, yeah, but look at the research that they've done to really grow awareness of this therapy for so many different issues, Yeah. I think everyone knows about lasers for, if you get a filling done and, to cure the filling or whatever. But like, this is a little different, but it works. We've got, I think we're at globally about at least 7,000 published papers.
Okay.
But it's just, I'm like you. I'm optimistic, but I'm also like, come on. What's taking so long? It's frustrating.
But I think at the same time, I do want people to be cautious too, because I don't want people to think it's so simple that, we just go out on Amazon and purchase something and use it. Because as you and I know, we have done, we've spent hours researching, reading, studying. And even as much as I've put into it, there's still so much more that I want to learn and need to learn. So I want people to embrace it and use it, but I also want people to be educated before they do it, because as you and I both know, you can do it incorrectly and either not be, have it be therapeutic, or as you've told me, some situations that you've heard where people can actually do some harm. So I don't want to make so light of it that people think, we can go treat this on our own. I do want them to be educated and learn the right way.
That is such a good point, because I think, the whole kind of plug and play aspect to PBM devices or red light therapy devices. We see it on Amazon. There's so much absolute junk out there.
Yes.
So the research on if we're looking at really robust research, it's like a prescription. So I think of like panels, just like a supplement that you take. It's good for your overall health, but if you have a chronic condition, I'm not sure how helpful it's going to be, especially because it's not in skin contact. And we know contact matters, but we have to use the right wavelengths, the right radiance, and we have to figure out how do we translate that from this device into what kind of energy is being delivered to the tissues. Right. So simply, because I do see it with women's intimate health, people think, oh, I'll just buy this, the cheap device on Amazon, it might help. But I'm seeing more cases where, especially around women who have neuropathy, like a nerve issue, it's not just, I don't say simple menopause, not just menopausal symptoms, but something else is going on. And a cheap device that they've just, with no protocol or an understanding of how we're going to use this device, and having trouble, like literally not being able to sit for days because it has triggered a flare in those nerves. So it's a little different with oral mucositis because it's more focused on, we're not treating nerves specifically. Yeah, I would say be cautious. It is quite a simple treatment if you have, the right device that's going to deliver that prescription, because that's what it ultimately is.
Exactly.
And you don't, like, if your doctor told you need to have a, prescription for amoxicillin, you wouldn't just say, well, let me play around with the dosage a little bit, because the doctor knows what does the research show? How many pills a day?
What is the right dose?
What is the and yeah. Stephanie, thank you so much. Will you please tell us where can people find you if they have more questions? I'm hoping that a lot of dentists are going to be watching this, and a lot of people in the PBM field. Oncology will be have their interest piqued and want to reach out to you. So tell us where people can find you.
Yeah. So, you can always go to my website, which is more focused on laser education and training for our dental professionals. And that is www.dentalteamdevelopment.com. Or my email is Steph, which is just STEPH @smiles2you.com. And Smiles, SMILES, and then to you is just TO, the letter U.com.
Right. And I will include all those details in the show notes so people can connect with you. But I really do appreciate you taking the time today. I think this is so important. We need to get the word out to as many people as possible, because unfortunately, most people know somebody that is going through a cancer treatment or will be going through a cancer treatment.
Right.
So the more we can help people learn about this really, really brilliant therapeutic treatment for preventing all of that pain and stress and distress, the better. But thank you so much.
Absolutely. Thank you. You are so amazing. And I am so thankful for just all of your knowledge and everything that you do. So I think that, yes, what you're doing is fantastic. And I've learned so much from you. So thank you.
Thank you, Stephanie. It's as you know, it's a labor of love. Once you get hooked into how really amazing this treatment is. And I know because years ago when I started looking at this, I thought this was all nonsense. It's woo. And I'm sure there's plenty of people out there still thinking that, but you and I have both seen the results. We know it works. We use it. Everyone in the family, even the dogs are using PBM, try and reduce your skepticism and cynicism and just go look at the research.
Yes. If you have time for a quick story, I will just share.
Please.
A couple months ago, in January, my uncle has been suffering. He's going to be 80, but very active guy, been suffering from knee pain to where it's limiting what he can do. And it's been really hard on him because he likes to be active. And my mom's been telling him about my light, and he's like, oh, just kind of ignoring it, blowing it off. We had a party. My mom's like, just bring the light. We're going to get him to do it. So I called him in and it's like, hey, uncle, let me just do this on you. And he's like, oh, because I'm his favorite little niece. So he let me do it. And I kid you not. So we had to go downstairs, and he's having a hard time. Even when he got there to get out of the car, he's having a hard time going down the stairs. We do it. He goes up the stairs and he was like, you've got to be kidding me. He's like, I can't believe I came up the stairs and I wasn't hurting. He went from thinking, like you said, that this has got to be some joke. This isn't going to work. I've gone to doctors. I've done this and that. I've done everything. Nothing works. To he was just so shocked. He ended up buying a device and then he's been doing it. It has changed. I mean, he's like, my cousin's like, Steph, now my dad thinks that he can hop around on one leg because of this life. I'm like, okay, I'm going to talk to him. Let's not push it. Let's still do normal stuff. But I mean, he's gotten himself back to all the things he wants to do. And I think that just, again, highlights when you're saying the skepticism that people have.
Yeah.
Just try it because it will amaze you.
Yeah. And it's so interesting, especially for like quality of life. And when you're older as well, like a simple thing, like, you know, a dodgy knee. And I was just treating my own knee last night. Got a dodgy knee, or you end up then you can't do the things you want to do. You can't get out of the house, and it's and we know loneliness is a you know, big factor in longevity and health. Yeah. For such a simple treatment. I'll just before we wrap up, my dad, very similar. Hi, Dad, if he's watching. I'm sure he will be watching. But again, like, I think sometimes family, they're like, yeah, there she goes again, off on down some rabbit hole with this light stuff. And he had a shoulder injury. Yeah, just something that it was just something that just tweaked, and he was in pain, you know, for a couple of weeks. And I suggested, look, and this is because he's in Ireland, and I suggested a device for him. And I says, oh, I just sent it. I'm like, I'm not even telling you, I'm just sending it. So just try it. Nothing to lose, try it. So he's like, oh yeah, he put it on, and a couple of days later, he's like, well, worked. I'm like, yep, told you. Yeah. So now he has one of my handheld lasers now as well. So anything, he's like, and anyone actually that comes to the house, he'll be like, well, hang on, they're complaining of a tweaked neck. Hang on, I get my laser. So he's 83. So he's out there, you know, promoting PBM to anyone who will listen.
All their buddies. Yep.
Yeah. So it's like, I think you have to experience it sometimes for yourself to see how quick it is.
Right. Yeah, I get it.
Don't know how it works. It does the job.
Right. Yes.
Stephanie, thank you. And we will chat again soon.
Sounds good. Thanks, Tracy.
Thank you, Stephanie.